I'm Dr. Dariush Saeedi. I'm a GP at the Spa Surgery in Harrogate, and I'm the lead for fifth-year medical students at my practice. So prescribing is a core part not only of the curriculum, but of course in developing student doctors to become clinicians. And one of the challenges we have is trying to teach them and support them in developing that core skill, but of course whilst maintaining all the necessary governance and the prescribing safety element. One of the things we try to develop in our primary care placements are looking at different ways of ensuring safety, keeping obviously a very high level of supervision, but at the same time enabling student doctors to be as autonomous as possible and try and develop their own independent clinical skills. So independent reasoning, thinking management plans through, and of course prescribing fits into that core skill as well. The way we try to look at that and develop a new way of trying to address the balance of governance with getting them to be as autonomous as possible was to use a counter-signature feature, which was on the System 1 operating system we use in primary care. So this enables a student to generate a prescription, which of course will still need signing by a clinician, the supervising clinician, but it means they can go through every step up to that point on their own, and therefore they are involved with the decision-making process and choosing the appropriate medication. One of the challenges about trying to help student doctors develop safe prescribing skills in primary care is that most of the prescriptions are electronic, so they're generated on the computer system. And because student doctors have limited rights on their smart cards, in practice it often means that they have to ask the supervising doctor to generate a prescription for them. And this obviously removes the student really from the natural narrative of a proper patient-doctor consultation, and they perhaps lose really important elements of that. And because it's such a core skill, one of the things we try to do is, by using an electronic countersigning method, we were able then to actually let the students go all the way through the consultation and even generate a script that, although would still need signing and approving by the supervisor, means that the student is much more involved in the whole decision-making process and starts to develop further those key prescribing skills. The way practically that's done is that the system can be set up to generate a task every time a prescription is issued, and that task fires to the supervising GP who has to complete it. So it's a method really of real-time audit. The other thing is that obviously the prescription has to be signed still by a GP. So again, that needs to be done, of course, as per usual sort of good practice. But the feedback from this has been really, really positive from students who felt much more involved with patient care, much more involved with the whole narrative of consulting with a patient. And it's really helped to build those core competencies for prescribing, which they can then carry on to their future practice as a junior doctor.